Diminishing returns are setting in.
Speaker, it's 6:15, it's allowed. Yeah. But maybe there's something she said. You said you have shares in Cooperative Bank of Kenya or dividends as part of your declared wealth?
Shares.
Shares?
Yes.
And that come after her 10 minutes?
Yeah. Okay.
You can interrogate her on that after her 10 minutes. You have now your 10 minutes or less to tell us the story of your life.
Thank you, Chair and honorable members, for giving me an opportunity to appear before you this evening and tell the committee members and Kenyans at large the story of my life. I was born in 1979 in Kericho, specifically Londiani, to a policeman and a policewoman. And later they moved and we settled in Trans Nzoia County in a place called Sekhendu, where I largely grew up in that area. Members and chairs, you are aware, policemen and policewomen in this country are people who are moved from one station to another. So my parents were being moved from one station to another to work. And it's that time that I was taken up by my maternal uncle, who I lived with during my primary education, which I finished at a school called Baraton Primary School. It is in Kiminini constituency in Trans Nzoia County in 1992. And I'm happy to tell honorable members that in the KCPE exams of 1992, I was the best student in then Trans Nzoia district. After that, I joined Maryhill Girls High School, a national school in Thika, where I did my secondary school education. While at Maryhill, I was engaged in several leadership positions, one of them chair of journalism, and then I thought that I would end up in media. And after Maryhill, immediately after, I got a call from KCB Bank to join them and work for them. And it was basically because I was very good in volleyball, so they were recruiting for their team. And my mom was like, who does volleyball for a living? So I did not join the commercial bank. So then I moved to MTC, Kenya Medical Training College, where I trained as a pharmaceutical technologist and graduated in 2000. Just to let members know that while at MTC, my parents, a policeman and policewoman, could not afford much. So from the second year of MTC, I did odd jobs to pay my school fees. After MTC, I managed to get a job in one of the pharmaceutical retail pharmacies in this country, where I worked for a period of time. During that time, I was also doing a degree in pharmacy, online degree from EG University in Turkey, where I completed. However, I did not get registered as a pharmacist because of the difference in legislation, the difference in the number of years covered in Turkey and covered in Kenya. But after that, while working, I proceeded to do a degree in Procurement and Supplies from Jomo Kenyatta University. And by the time I was doing that degree, I was working at Mission for Essential Drugs and Supplies. Chair and members, I stopped working in the pharmacy. My last stage as a pharmaceutical technologist was in charge of AAR healthcare in Kisumu County. So when I joined MEDS, I started as a junior operations officer. But while working as an operation officer, one of my responsibilities was to consolidate orders and send medical supplies to faith-based hospitals in this country. I then realized that there was a gap, that any time I was fulfilling orders from these faith-based hospitals, we could not fulfill them at 100%. And at that note, I told my supervisor that I think we have a problem in procurement. And I volunteered myself to work in procurement at MEDS. When I volunteered to work in procurement, that is when now I enrolled again for my master's degree while working there. And I ran through the ranks in procurement as an officer. Up to the time that I was leaving MEDS, I left as the procurement manager. And as you are well aware, Mission for Essential Drugs and Supply is the second biggest, largest medical supply chain organization in this country that is run in a way that I could say very efficiently. So I worked at Mission for Essential Drugs for a good 7 years. Chair, I left in good terms when I had just finished my master's, and for the members' sake, I briefly interned at KEMSA during my master's level for a period of 3 months. After that, Chair, I joined the Nairobi Women Hospital, where I was in charge of procurement. Chair and members, at Nairobi Women Hospital, I was in charge of end-to-end supply chain. What I mean by end-to-end is that I was in charge of the tomatoes that cooked the patient meals. I was in charge of the linen that was spread on patient beds. I was in charge of the equipment that was used in theater. And what many people don't like to hear, that I was in charge to ensure even the equipment in the mortuary worked while at MEDS. Honorable Chair and members, I left MEDS in 2016 to run for an elective seat in Trans Nzoia County, Women Rep. At that point, my party did not give me a ticket, so I dropped out at the nominations level. And I came back, and in 2017, I got another job with the Global Programs for Research, which is an affiliate of University of California, San Francisco, as their head of supply chain, and that is where I have worked to date. I took leave to also run for Women Rep in 2022. This time, I was lucky, I got the party ticket and went all the way into the elections. I didn't make it, and so I returned back to work after my leave. I'm still an employee of Global Programs for Research. Chair, I have been appointed on the Council of the Kitale National Polytechnic, which I joined in 2019. I served in the Education, Training and Research Committee. I served in Finance and Administration Committee, and I was the chair of the Human Resource Committee. Chair, I have also done consultancy services, previously for Ministry of Health, in commodity management for Nyamira, Kisii, and Migori County, where I was training all cadres of health on commodity management. Chair, I've also done consultancy, which I'm still engaged in, with a firm called 54 Gene for Research and Discovery Limited, that is scheduled to set up one of the biggest genomics laboratory in Kenya, and I'm still consulting for them. Chair, that's the story of my life, but I also need to say that I am married. I'm a mother of 2 biological children, but I take care of 2 as a guardian, and many that I take care who live with their parents. Thank you very much, Chair and members.
The floor is open, members. We'll start with the deputy speaker.